Let's discuss about an autoimmune disorder called as Behcet's disease. This Behcet's disease is also called as oculoorogenital syndrome. As name indicates, we see ocular lesions, oral lesions and genital lesions in this syndrome.
Behcet's disease. Behcet's disease is a chronic relapsing multisystem autoimmune inflammatory disease, and it is also called as oculoorogenital syndrome. And in this condition, we often see variable vessel involvement, and there is also involvement of GIT, joint, neuro, lung and cardiac involvement. And this condition, Behcet's disease, is more commonly seen in young males, and the disease occurrence is more common in third and fourth decade, that is in between 30 and 40 years of age. And the HL association associated at the HLA B5, B51 has got very strong association with Behcet's disease. And the antibodies which are involved in this condition are the anti-Saccharomyces cerevisiae antibody, anti-enolase antibodies and anti-selenium antibodies. And as already I said, oculoorogenital syndrome, the oral lesions seen in this condition are the painful oral aphthous ulcers are seen. These ulcers are often recurrent and they can occur anywhere in the oral cavity, and these ulcers are often shallow ulcers and they heal without any scarring. Whereas coming to the genital ulcers, and genital ulcers, scrotum is the most common site in case of males, and in case of females, labia is the most common site, and these lesions are often painful as oral ulcers, but these genital ulcers are often deeper, lesser recurrent and often heal with scarring. And the genital ulcers often space glans, penis and urethra. And coming to the test, in case of Behcet's disease, cutaneous manifestation are often seen 80% of the patients, and these cutaneous manifestations are papulopustular lesions and tender erythematous nodules on medial tibia. We call it as erythema nodosum. And these erythema nodosum with hyperpigmentation is seen in case of Behcet's disease. And what is the complications of Behcet's disease? Complication of Behcet's disease is mainly pulmonary artery aneurysm will be seen, and venous thrombosis is more common than that of the arterial thrombosis. And what are the ocular manifestations of Behcet's disease? Ocular manifestations mainly include like panuveitis, joint and GIT involvement also.
Okay, let's discuss about the treatment available for this Behcet's disease. And the treatment used in this condition are as most of the lesions are ulcer lesions, we use topical steroids and prostaglandin E1 gel. If there is any systemic involvement, then we use methotrexate, steroids and thalidomide. And if there is any severe involvement, we use systemic steroids also. And this condition usually has more sort of remissions, and also relapses are more common in this condition called Behcet's disease. Thank you for watching.